The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified healthcare provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk. Welcome to the Birth Baby Podcast. Each week, you'll find guidance, encouragement, and practical tools to support you through pregnancy, birth, and the postpartum journey. I'm your host, Ciarra Morgan, a certified birth and postpartum doula, hypnobirthing educator, and pediatric sleep consultant. I'm also the owner of a doula agency in Austin, Texas, and the founder of the Birth Baby Academy, where I offer classes for both parents and birth professionals. Thanks for being here. Hello, everyone. Today I am here with Jessica Semar. She is an IBCLC with It's More Than Milk here in Austin, Texas, and she has been serving families for over 8 years. And I asked her to come on today to talk about something that so many parents ask me about. And I'm like, hey, out of my wheelhouse. What in the world should we be pumping and dumping? Like, what about safe alcohol consumption during our, time of breastfeeding or lactation? So, Jessica, thank you so much for being here today. And I'm excited to kind of myth bust a little bit with you.
Yeah, thanks for having me.
Yeah. Do you get asked this question a lot?
Yes, definitely. It's a pretty common question that parents have.
Yeah, I've heard all sorts of things like just mix the non-alcohol milk with alcohol milk to, dilute it and all sorts of things. So why do you think this is such a hot topic when it comes to breastfeeding?
Well, I think that there's a lot of mixed or misinformation around it, like a lot of things that have to do with lactation. People are hearing different messages from different providers or friends about what's safe and what's not safe, and parents want to make safe choices about what they're doing during pregnancy and lactation. So I think that's a lot of why there's confusion about it. And parents also want to know how much lifestyle adjustment they're going to have to make if they're choosing to breastfeed or to pump milk for their baby. So when they're making feeding choices, I think that comes into play, wanting to know, how does it work? Is it safe? Do I have to completely give up drinking or whatever other things I might be doing, for this whole prolonged period of time?
Yeah, it's like, okay, well, I knew I needed to quit during pregnancy, but how much leeway here do I have when I'm feeding my baby? So, all right, the simple question, let's ask, do breastfeeding parents actually need to pump and dump if they've been drinking alcohol?
Not typically. It would depend a little bit on how much alcohol you've consumed and what the timeline is, but moderate consumption of alcohol, no. Pumping and dumping isn't going to accelerate how quickly your body metabolizes alcohol. And I think that's really where the myth around that comes into play. But say you were out on a date or at a party or, a wedding or something like that, and you're, either separated from your baby, or maybe you've had more than one drink, 2 drinks, 3 drinks, something like that, and you're feeling intoxicated and it's time to empty your breasts. Your breasts need to be emptied regardless of whether your baby is there to feed. So pumping when you are intoxicated, that milk, maybe it makes sense to dump it, or like you had mentioned, dilute it so that the milk that you're expressing that has maybe an unacceptable level of alcohol in it isn't going to be fed to your baby. But pumping and dumping to accelerate getting the alcohol out of your milk to make it safe to feed is not necessary or helpful.
Okay. Yeah. I think a lot of people do think that if you empty the milk that's in there, it's going to take out the alcohol, and then whatever new milk comes in behind that won't have alcohol in it. But it's not that. It's like, just like your blood alcohol content goes down, you don't have to take that blood out to get the alcohol out.
Right.
Our breast milk is the same. So, how long does it stay in there? How long does the alcohol stay in the breast milk?
Yeah, so I mean, with it kind of depends on a few things, like just the same as how intoxicated you might become if you had any alcohol. That's going to depend a little bit on things like how much food you have in your stomach, your size and weight, your metabolism, and how much alcohol you've consumed. But generally, if you have a drink, like a 5-ounce serving of wine, and I think that's like 1.5 ounces of liquor, like one drink, basically, Alcohol peaks in your breast milk about 30 to 60 minutes, generally after you drink it. And then by 2 hours after you've consumed it, it should be out of your breast milk and out of your, blood alcohol too. So generally, if you have a drink and then 2 hours later you haven't had another drink, you should be perfectly fine to feed or pump as you normally would.
Okay. Yeah, because you hear people say like, well, you shouldn't, have too much in it, but like how much is too much? How do you know if there's like a safe amount of alcohol? And like you said, we all metabolize differently. I don't even drink alcohol because it affects me so badly. But if I were to have literally half of a drink, I wouldn't even be able to drive. My husband could have 3 and you can't even really tell that he had 3. And so really it doesn't just depend on your weight or whatever too. Like sometimes genetics come into play here and how much you've drank in the past. So, now I know that you said like how much food you've had, how much weight you are, all of these things can affect how quickly it clears. Is there a safe amount? Like if you only had this much, then you don't really have to worry about how long it's going to take for it to come out?
Yeah, so that's a good question. I think first of all, like safe amounts of alcohol, that's kind of coming under some scrutiny not really related to breastfeeding, but just for individual health. The Surgeon General issued a warning this year about alcohol consumption and its association to all types of cancers and breast cancer for women in particularly. So I think health guidance generally around alcohol consumption is changing, where in the past we kind of were, everybody really was told moderate alcohol consumption is kind of safer or like has better health outcomes than no consumption, or of course than heavy consumption. And now that advice is changing. But when we're thinking about lactation, we're thinking about how much alcohol is getting through breast milk and into your baby. And that's going to be very little to none if we're following kind of those guidelines for moderate consumption, which for women is considered 1 drink or less per day. Now you mentioned, your husband's metabolism versus yours, and the guidelines for men have always been more liberal. So 2 drinks a day or less for men, because different metabolic things and size generally between men and women, they can have a little bit more alcohol without having the same level of intoxication. And I think there's also something about an enzyme that breaks down alcohol that men have more of it than women. So generally, weird. So for women during lactation, the CDC's guidance currently, and that may change, as some of the health guidelines change, but currently 1 drink or less per day is considered moderate consumption. And they also state that there's no evidence that there are any negative outcomes for babies when a lactating parent consumes alcohol moderately, meaning 1 drink per day or less.
And it's so different than during pregnancy.
There's no safe amount during pregnancy, and it's different because in pregnancy, everything is going through, if it's in your bloodstream, it's going through the placenta potentially to your baby directly, where with lactation, you're ingesting it orally, it's going into your stomach, it's going through your kidneys into your bloodstream. So it's not like now alcohol does pass pretty readily into breast milk, but it's not at the same like 1-to-1 level, the exact quantity of alcohol you ingest is in your breast milk. It's going to be diluted, but it is still going to be there for about 2 hours per drink for most people. And, the guidance usually, though, when you're trying to determine am I okay to go ahead and nurse or pump and use this milk, is do you feel neurologically impaired? If you feel a little bit tipsy or intoxicated, then there's still alcohol in your bloodstream. And you might want to be judicious about if you feed, so the guidance is usually if you feel neurologically unaffected by alcohol, then you're perfectly fine. If you're sober enough to drive a car is kind of the analogy that people would commonly use. But if you're sober enough to drive, you're sober enough to breastfeed, it's not going to be in your milk anymore.
I've heard one, like, if you feel like you can hold your baby and carry them safely, because if you feel a little woozy, you maybe wouldn't want to walk around with your baby. I also have heard
valid point.
Yeah. I've also heard if People will so much judge somebody, right, with a baby attached to their breast while they're drinking their glass of wine.
Yeah.
But actually, it hasn't gotten into your system yet. So maybe that's the best time. Yeah.
Yeah, no, absolutely. Timing matters. So, I think you've made a great point, because if you're out in public and you're having a margarita and you're breastfeeding at the same time, you may get some judgy glares, or even somebody say something to you, but it's not immediately in your milk. It takes 30 to 60 minutes to even be present in the milk, or to peak in the milk. So generally the advice is either have your drink, right after you feed or pump, or even during. Sometimes it's not that relaxing to sit with your glass of wine or whatever while you actually have a baby attached to you, but if you're just thinking about timing, then that makes sense.
Yeah. So are there any tools or apps that you recommend that help parents calculate when it is safe to breastfeed again after drinking, or is there not really any of that technology?
I don't personally feel like those are super helpful. So there are test strips that you can test your milk, which would require you to pump the milk out anyway.
I know somebody that did that every time she pumped, because she was a little bit of a drinker.
Yeah.
And she would test it, and if it was too high, she would mix it with other milk. I was like, I think we have other problems going on here. But if we're having to do this, maybe we need to talk about something else.
I think that's a really valid point. If it's common enough in your lifestyle that you're wondering if it's safe, and you're finding that you might need to test and analyze that frequently, then maybe it would be good to evaluate your relationship with alcohol. Yeah. But the test strips, they're not super, they haven't been well tested. So they evidence-based, they're not super evidence-based, they're expensive. And generally, we just don't need that level of precision if you're drinking moderately, and moderately and occasionally, which is kind of the most appropriate relationship with alcohol when you're parenting a newborn or a baby. Really.
Yeah, in general, really.
Yeah.
I think that we do have a culture right now that there is a pretty heavy alcohol use in our culture, and it's something that I see people have a lot of focus on. And actually, interestingly enough, sometimes it's not the breastfeeding parent that is worrying about this as much. It's like judgment from their partner. Maybe their partner is really worried about them feeding the baby this milk, and they think you can have zero. And so that's another reason that I really wanted to do this episode. Wasn't just for the parent who's providing the milk, also for the parent who isn't providing the milk and may just feel really uncomfortable with the baby having milk that may have alcohol in it.
Yes.
So I think it's so important.
Yeah, that's a great point. And just having some evidence-based information about, whether that's medication or whatever it is that you're doing. So that, if someone has a question, whether that's the parent or partner or family member, we have a response that's educated and, most of those comments and questions are based out of concern or, love for the baby or, concern for the partner or whatever that might be. But, for the person who's lactating and parenting, I think there's always a lot of judgment, and, it's good to have evidence-based information to kind of respond, but to be honest with yourself about also,
I do. I some of the times when people want to test too much or I want to get those test strips, part of it could be, do you have an unhealthy relationship with alcohol? But another part is some people do it very, very moderately, but they have so much anxiety that is what, and then I'm like, okay, well, maybe we need to talk about anxiety. There's some sort of underlying something here oftentimes, but there's so much we don't know, and there's so much that there's not a whole lot of research about, and that makes it really difficult for parents. I feel like a lot of things around parenting we have to navigate that don't have hard and fast rules. So I appreciate you kind of talking about some of these with me. Is there a myth that you find that you'd like to bust about alcohol and breastfeeding? Is there something?
One that, I think the pumping and dumping is a pretty persistent myth, but we covered that. I think another one, and this is not as prevalent as it, I think it was when I had my first baby. But, beer, like being a galactagogue, and being good for milk supply, I think was kind of a common myth.
They used to say, have a Guinness.
That's what my midwife told me to do, that was 21 years ago, but sit down at night, in the evening, have a Guinness. It's good for your milk supply. It'll help you relax.
So that's not a thing?
So barley is a galactagogue, and there may be something there that the barley in beer could increase prolactin, and you might see some increase if you're ingesting barley. But alcohol is actually kind of it opposes oxytocin. One drink is not super likely to cause a big disruption, but more than one drink definitely might inhibit your letdown response and the amount of milk that's transferred during a feeding because of that. And so you might see a fussier baby because there's less milk flow. Yeah.
And we need to be so hydrated, right? That's interesting. I never really considered that.
Yeah. And again, that's not to say you can't have, if you want to have your one drink as a Guinness, go for it, but don't do it because you think it's good for milk supply. Or
if it's the barley, maybe take a supplement.
Right.
If that's why you're doing it. There's lots of really cool, oh my gosh, it's a local company, which Legendary Milk. I'm like, lots of Legendary Milk supplements out there that have lots of things in them that do the same kind of thing that you're hoping for with that Guinness.
Right.
Well, I just love the work that you guys do with It's More Than Milk. I think that it's such an incredible company with such a great mission. And I love the thing on the front page. If you guys go to their website, it says like, we cry over spilled milk or something like that, which is great. Like, yes, we should cry over spilled milk. But it is so great because you guys are so supportive of meeting parents where they are. And I think that there's so much judgment right now just in general in parenting that I really love that you guys help people meet their goals, not the goals of like whatever somebody made up as the gold standard. So if somebody wanted to work with you guys and learn more about you guys, how would they find you? And I'll include it in the show notes as well.
Okay, great. Yeah. So the best way is probably you could go to our website. It's morethanmilk.com. If anyone ever wants to email me directly, it's jessica@itsmorethanmilk.com. You can also find me on Instagram, jessica.semar.ibclc.
Awesome. I've loved talking to you. I think that it is so important that we just keep these discussions open and help parents understand more about their bodies because goodness gracious, I sure did not know very much at all when having a baby. I felt 15 years ago. I felt completely novice. So I love having these discussions that help us learn more about our own bodies. And I really appreciate you being here today.
Yeah, of course. I love the work you do too. It's great. It's great for new parents and for professionals too to learn and to connect. So thanks for having me.
Thank you. Thanks for listening. If you enjoyed today's episode, please take a moment to follow, rate, and review the podcast. It helps us reach more families who can benefit from this resource. For more resources, classes, and services, head to empoweredbeginningsatx.com or check out the Birth Baby Academy at birthbabyacademy.com. Until next time, wishing you confidence and calm on your journey through birth and beyond.